Welcome, everyone. Thanks for taking the time out of your schedule to join us today for our next session on the heart of rural nursing as we discuss mental and behavioral health. Next slide, please. By way of introduction, my name is Stacy Villano, and I work for the Global Rural Nursing Exchange Network. We are an international organization whose mission is to unite rural nurses, nursing students, and researchers who all have a passion for improving the health of rural communities and appreciation for the nurses that serve these communities. We have an online communications platform to bring people together to communicate, troubleshoot, make connections, as well as various learning opportunities on our website. Part of the way that we disseminate this information and bring people together is through partnerships, like the valued partnership that we have with USD. We are very grateful for this ongoing relationship where we are able to help bring these real life experiences that you're going to share today with our global platform in hopes that we can not only share the work that you're doing, but inspire other people worldwide to either adopt a similar program or students worldwide to consider going into rural as part of their postgraduate work. Next slide, please. Before we get started, I know I briefly mentioned earlier, but if you've just come on the call, if you have been admitted under somebody else's link and your name is not showing as your own, we ask that you please update that so we can see who is speaking. Your microphone is automatically muted. During the Q&A sections, feel free to unmute your microphone so that way you can live ask your questions. You can also use at any time the chat feature to pose a question, and we will be able to field that on your behalf. We also ask that you keep your video on at all times. Given the nature of the conversation today, please do remember to maintain confidentiality when you're speaking or asking a question or sharing a story. If you have any questions, if there's any technological hiccups, if something's going on, just drop that in the chat. I will be monitoring that, and I will do my very best to help you get the most out of your participation today. In order to support the growth of the ECHO movement, Project ECHO does collect participation data for the tele-ECHO program, just always something that we like to disclaim. This is definitely a great opportunity to contribute to the conversation, share your knowledge, bring stories forward. So we always welcome you to do that during the appropriate times in between the student sessions. Make sure you introduce yourself, keep that camera on, keep your name updated. And as you heard in the beginning, we are recording this session. This will be posted along with the other webinars in this wonderful series on the GRNEN website. If you need to go back and refer to this for anything, share it forward, or if you would like to view any of the other sessions in this talk. With that, next slide, please. I'm happy to turn this over to Dawn Warren, who is your wonderful speaker for today's presentation. Hello, Dawn.
Hello, thank you, Stacy. Welcome, everybody. I was just flipping through, and there are a lot of people here today, which is fantastic, especially for a Monday morning. So always great to have so many people join us. So I have been involved in this grant since it started, and we're really excited today that we're going to be focusing more on the mental health part of this grant and looking at some of the workforce challenges that we have across the state. Okay, next slide, please. So a little bit about the HRSA grant. For those of you who don't know, we are actually in the last semester. The grant actually just ended the end of September, but we're finishing out these ECHO sessions. We had a 3-year grant, and we received $1 million. And it had multiple parts to the grant that involved recruitment, education, experiential learning, etc. One of the biggest parts, and what these students that are presenting today, was that they spent 3 weeks approximately, so it was 132 hours, doing clinical in a small rural hospital. somewhere in the state of South Dakota. And the grant paid for paid for their travel, their meals, depending on where they stayed. Some of them stayed home, some of them traveled quite a ways. I gave them a stipend and paid for their miles, etc. So it was a fantastic learning experience, and I'm sad it's going to be ending, honestly, but great learning experience for everybody. Okay, next slide, please. So we are located, for those of you who are not from South Dakota or not even from the United States, if you end up watching this in another country, we are located in the United States in South Dakota. Next slide. And this just shows some of the places in the state of South Dakota that we have done this grant. So with the X's being small rural hospitals that students have been at, and this isn't even all inclusive. So there have been probably another 8 to 10 that we have done. So we've been kind of all over, and many of these places we've been to many times. I believe we've had over 100 students do this grant. So it's been a great learning experience out in the middle of rural South Dakota. As you can see, kind of the upper part of the state up in the north and then kind of to the west, there is not really any X's because there's not really hardly any hospitals. So that is a huge disparity of level area in our state where there just isn't much for healthcare available. Okay, next slide, please. So the two main objectives today for our session, the first one is just to learn about key lessons learned by the 4 students that are with us as they talk about the different places and experiences that they completed the HRSA grant and the things that they learned. And then they're going to talk a little bit about mental health as it relates to where they were at. And then I'm really excited that our speaker today that is with us is going to, from Department of Health, is going to talk to us about the mental health workforce shortage. And she will kind of talk about all the work that they are doing in the state to work on mental health workforce challenges. Okay, next slide, please. Okay, so sharing what we learned. So the first student who's going to present today is Lily Toms, of course, who is a USD nursing student, and she completed her rural experience in a town that's a little bit bigger. It's in Yankton, South Dakota, but still considered rural. And hers was really unique because it's a facility human services center that's, I wouldn't say all mental health. Sometimes they have other things going on, but it is primarily mental health, just multiple different areas of mental health. So this is a perfect person to have speak today because it fits very well with what we're talking about. So Lily, I will turn it over to you.
Thank you. So yeah, my name's Lily. I am a 4th semester nursing student, and I'm actually from Yankton, South Dakota. So this was a really good opportunity to stay in my community and get to experience a new facility. Um, okay, so I did my experience on the chemical dependency unit. This unit was particularly for substance abuse, lots of legal kind of situations, so like court ordered treatment for patients that are in prison or jail. And there was 2 hallways set up for females on one side and males on the other. Their day-to-day is very structured with group therapy, AA sessions, NA sessions. So lots of good structure treatment. Obviously, mental health resources is excellent at HSC. There's just about every counselor, physician, treatment stuff you can imagine there. It's a great state facility. So they have everything they could possibly need. And that could be ranging from individual like resources or like as a group if they don't want to do individual stuff. My memorable story is kind of unique. It's not necessarily like a great experience, but I did not know this was a thing. So, when dealing with legal patients on this particular unit, if they come to our unit and are not obeying the treatment kind of guidelines or just taking the treatment process serious, the nurses have the capability to terminate them from the program. And so that was very unique to experience. We proceeded with all of the discharge paperwork, everything, and then called the sheriff department for the city. And they pulled up at the back door, and we did not warn the patient ahead of time just because we didn't want them to freak out. And then we proceeded to kind of guide them through some double doors where it would be a safe area with security staff waiting on standby and inform the patient that they were being terminated for this reason and that they would be taken with the officers. So it was very interesting to experience, but I also feel like it's a really good um, option because we had two patients in 2 days that were really throwing off the culture on the unit, patients that were there for very serious, like true recovery, weren't able to focus on their recovery because of these individuals. And I would say my key lessons learned are that every single patient is going through something very unique, and you really have to put yourself into their mental state or like their mindset to really understand how to treat them best. If you don't understand why they're thinking the things they are or acting the way they are, it's going to be very difficult to treat them correctly and like make um, good nursing judgment.
Great job, Lily. I have a couple questions for you, a couple or thoughts in general. First of all, I'm so glad that you picked a mental health facility, even though I know you have another job, I believe in an ER, don't you? Or in a big, yeah, because especially chemical dependency is going to affect so many patients that you care for almost everywhere. Everywhere that you go as a nurse, you're going to deal with that. So I'm so glad that you chose that facility and had that great experience. One thing I think is interesting for the people who are listening to know, I assume since most of the patients there, or at least a good chunk of them, are court ordered. So like this person who the nurses chose to discharge, then do they like take him to jail? And then I assume then the judge finds out that he didn't cooperate. And so then you kind of have the,
Yes, they would
what
be
follows.
marked, yeah, they would be marked as they did not complete the treatment program. So the judge would then recognize that they were not taking it serious. Their probation officer, whoever, would be notified and everything and handle it, but they would be taken to the local jail. And then if they came from a different county, then they would get transported eventually.
Okay. Okay. So yeah, not probably not helpful to the patient in the long term because they'll probably have more prison time, etc. And then I'm also curious when you said they have all the different counseling sessions and that they do and AA and are the family involved? Does the family come for any of that, or is it strictly just the patients?
So with it being kind of a unique legal unit, there are visitors occasionally. Typically, they try, so all of these patients are there for a 30-day treatment program. So it's like a set 30 days. Can be longer, can be shorter, just depending on situation. But they typically try to start with a video visit just to kind of gauge if it's going to go well, interactions. And then if the video visit goes well, they typically try to do like one or two in-person visits. Because I mean, 30 days goes pretty fast.
Very helpful. Other questions from people? Things you're curious about? And certainly, I can't see everybody, so speak up if you do have something, or if I move on and right when you're thinking of something, you can certainly ask at the end too. Okay. All right. Thank you, Lily. Great job on that. We'll go ahead and move on. So our next presenter is Cameron Vold. Cameron, again, is also a USD nursing student, and she completed her HRSA immersion at Avera St. Mary's Hospital in Pierre, South Dakota. All right, Cameron, I'll turn it over to you.
Yeah, so like Professor Warren said, I'm Cameron Vold. I'm a fourth semester nursing student currently, and I just completed my immersion at Avera St. Mary's Hospital in Pierre, South Dakota. So a little bit about the hospital. I was on the fourth floor, top floor of the hospital. It was 25 bed unit. It was just a regular med surge peds, and then there was an ICU wing in the back. The hospital has med surge floor, labor and delivery unit. They do some different procedures, have general surgeons, and then just a few other specialists. It's a pretty good sized hospital for being rural. Mental health resources. There was little to no mental health resources at all on site that I found. Everything that was done was through telehealth or e-health, working with a professional outside from the Sioux Falls area. I actually had a patient experience with a mental health crisis when I was there, so I got to see firsthand how those rural access hospitals handle that. It was interesting to see how little the hospital and like the nursing staff can really do for those patients. The patient was on a one-to-one, and they just had like the telehealth visits with a provider from Sioux Falls, but just with the patient's condition, they were unable to really communicate with the provider anyways, and so there was just really nothing that we could do. So that was interesting to see and learn that how long of a wait time it is. My nurse was told that it would be over a month before this patient would be able to find placement in a mental health facility. So that was kind of sad to listen to. A memorable story. So one day there was a patient it was not our patient, it was just another patient on the floor that was just getting ready to go. They were wanting to leave AMA. The provider was going to just discharge them later in the afternoon when like their fluids were done. But the patient said, I want to leave now. I'm going to leave AMA if I'm not discharged. So the provider discharged them. They were walking out to their car, and it just so happened that another patient was watching out of a window and watched this other patient get into their car, and it looked like the patient who left was having a seizure as they were trying to get into their car. So this other patient came to the front desk, nurse's station, and said, "Hey, I think there's something going on in the parking lot." So then some staff ran down there, and the patient was fairly unresponsive. And so then it was interesting just to see they brought the patient back into the ER. And the patient did end up getting sent out to Sioux Falls, but it was just crazy to see something like that happen. And then my key lessons learned was actually how few resources there are at these rural hospitals. Being in Pierre, I thought that there would be more, since Pierre is really on the bigger side of rural. But just something that was so interesting was that in a small hospital, you really are your own resource, and you kind of have to figure things out on your own, just because there's so little stuff in the hospital.
Okay, excellent job, Cameron. I still remember when you told me about that. It's just crazy to me that in the middle of the state in Pierre, that there's so few resources. Um, and I'm sure Bev is nodding her head, but across the state, we need more. Just plain and simple, we need a lot more of everything related to mental health. So I'm curious, with the gentleman that left AMA and then had the seizure, do you know if there was a dependency issue? Was there an addiction to some?
Yeah, I think that, I mean, like I said, it wasn't our patient,
Yeah.
but I think that another nurse had mentioned that they thought this was a patient that was using outside of the facility, and um, It was kind of a guess by the ER staff, but they were guessing that he went out to his car and took some sort of substance, and that is what caused this.
Yeah, that's exactly what I was wondering. When I worked in the emergency room here at Monument Health, and then up on the floor at Monument Health, we did see that sometimes when patients were addicted to, whatever, and when they started to the point where they were going to start to have some detox stuff, if they didn't get their next fix, they would check themselves out. They would just leave, and so yeah, and then that might be what happened, that he had access to it, unfortunately. So it's a good thing someone saw him. Hopefully he can get the help he needs.
Mm-hmm. Yep.
Okay, other questions for Cameron? Okay, excellent job. And again, if you think of some, please let me know, and we'll bring them up here at the end. Okay, we'll go to the next student. Okay, Emily. So Emily is also a USD nursing student, and she completed her HRSA rural immersion at Platt Healthcare Center in Platt, South Dakota. So Emily, we'll turn it over to you.
Yes, so as she mentioned, I am a first semester nursing student. I did my immersion in Platt. Platt's about 1,500 people, so the hospital's small and the town is small. And then I spent most of my time, they have a med surg and an ER, and I spent most of my time in the ER. Pretty much any emergency that came in, there was usually 2 to 3 nurses on at all times. So kind of 1 or 2 nurses would go to the emergency and then one would stay on the floor. And then during the daytime, they had a tech on also. So the tech would stay on the floor too. So I spent most of my time in the ER. If there was anything, I always went over there. And then just for the hospital overview, there is 3 ER rooms and 10 med surg rooms. And then they had 2 rooms that they used only for outpatient. So people would come in to get like minor chemo infusions and just like infusions and just outpatient infusions. And then they had 1 room that they designated, it was like a negative pressure room, and they designated that to COVID rooms. So then for mental health overview, they really didn't have much for mental health. And then my memorable story also kind of ties into that. We had a young man who came into the ER, and it's kind of a small town, so everybody kind of knows everybody. So the nurses all there knew who he was, and they didn't call ahead or anything to tell us that he was coming into the ER, and he was being very violent, and he was a risk to himself and others. So we actually had to chemically restrain him, like using medication. And he had, like, this had happened to him before, so I think he kind of knew what was going to happen when he came in, but his family brought him in and they asked for him to be transferred somewhere. So we spent pretty much the whole entire night just trying to contact places and trying to use like e-telehealth to just to get some resources for him so he could go somewhere, because his family couldn't take care of him and he couldn't be left alone. And then some key lessons that I learned, I kind of thought that just being in a small hospital, you wouldn't see quite as serious of things or quite as many things. And while I was there, we had many people who went out on the helicopter, many people who were transferred. And so I felt like I saw extremely serious stuff while I was there. And I kind of wasn't expecting that. And then the nurses just had to be like, they had to have the skill sets to deal with young kids, old people, and it was the same nurses that were on. So in 20 minutes, you could be dealing with a 5-year-old and an 80-year-old, and you just have to know how to deal with all of them. So that was my key lessons that I learned.
Mm-hmm. Awesome. Thank you, Emily. Clara, can you switch to the next slide, please? Just so they can see those. Perfect. Okay. I have a couple questions for you. Actually, you can go back while we're still in Emily. Thank you. One thing I was thinking about, so some students who've been in these truly small hospitals and communities, especially like that one, did you see or hear much about farmers and farming and mental health? Because in the past we have, and I don't know if you saw anything while you were there, but there's so much mental health with some of the farming issues.
I didn't really see anything while I was there, but I am from the Platte area, and like there has been over like the past like 10 years, there's been definitely an increase in like suicide and suicidal behaviors from farmers in the area. So definitely the nurses and the community takes it very seriously. if a farmer comes in, or just like a blue collar worker in general comes in for a mental health crisis, like nobody was joking around with any of this mental, like anything that the person that did come in, like his mental health, everybody was very serious about it and really not downplaying it. And they were really working on trying to find him placement, and they were not going to send him home. Like they were very adamant that he was going to go somewhere and get help.
Excellent. Okay, that's good to hear. Because yeah, as a whole, and I'm sure you know this too, Emily, but with these small rural communities, a lot of times farmers are afraid that somebody will see them, right? Or since everyone knows each other, like if they pull into the ER for help, they know that other people are going to see them that know them. And so a lot of times they won't go. And a lot of them really rely on the telehealth if you can get them to do that, because it's the only way that other people won't know that they're getting help. So it's really good that when they do come in, that people are supportive and don't downplay it. That's good to hear. Okay, questions for Emily? Okay. All right. Did I? Yeah, that was the main thing I had. Okay. So our last student then is Maya Timmerman. And Maya completed her experience at Pioneer Memorial Hospital, located in Viborg, South Dakota. So Maya, it's up to you. Go for it.
Thanks, Professor Warren. So like she said, I completed my HRSA grant in Viborg, South Dakota, and I actually completed mine after my first semester, so last summer, so summer of 2024, and now I'm currently a fourth semester nursing student, so it has been a little bit since I've been there, but I did have a really good experience, and I learned a lot just from being there that I've taken into clinicals with me and have just kind of used that experience throughout the rest of nursing school. So, a little bit about the hospital is it has 10 beds, and then two more infusion areas, and then two ER beds. It has an assisted living, a nursing home, like a convenient clinic. There's also OT, PT, and ST all offered at this facility as well. They also do procedures like colonoscopies about every 2 weeks or so. A surgeon from Sioux Falls comes down and does that. At Viborg. They have swing bed options, they have the infusions, hospital stays, and they don't do any OB unless it is absolutely emergent. So they do have a room that can be used for OB situations if need be. Viborg is a little bit of a smaller town, so that's kind of why everything's in one area. The population is about 824. It's between Sioux Falls and Vermilion, so it's not that far. And they have a lot of just random things in the town, like a grocery store. They're kind of known for like their movie theater. And they do have like a library and community center and things like that. For mental health, I did not encounter any mental health situations with any of my patients. But we did have telehealth accessible if need be for any of those situations. So we did have like the iPads. We did have two of those. So if we needed to ever use those, we did have those resources. But with mental health, and it kind of ties in a little bit to my memorable story, is there is resources offered for all staff. So whether you're a provider, a nurse, you work in the nursing home, at the clinic as the front desk, anything, there is resources for mental health for the staff, which I found to be very good and very helpful. Because with my memorable story, I had a patient who I was there for a couple days in a row, and I slowly started to see her decline. And in just from my experience, I feel like it could have been a very preventable situation, but it was really hard to see a patient decline pretty quickly and then eventually have to leave the hospital in Viborg and have to go get more help somewhere else. So being able to learn from that experience, and that kind of goes a little bit into like the lessons that I learned, is advocating for your patients even when you could be wrong is extremely important. And just being a first semester, just had finished that semester nursing student, I felt like I couldn't really say anything because I didn't fully understand yet. But always advocating for your patients, because you might be right and you could be wrong as well, but at least, you know, you looked at everything and you're doing everything that you can to help them. So Having those resources like I had talked about for the staff, I think is important to deal with, sad stories like that and being able to make sure that you're okay and that you can learn from the experience to help the next person. Um, and yeah, it was overall a really good experience and I was able to learn a lot from being here. So
Thank you, Maya. Yeah, I'm so glad you brought up just the importance of being a patient advocate. Because as you guys know, you talk about that over and over and over in nursing school. And that is going to be one of the most important things that you do. When you have that intuition, that something's wrong, like she said, you speak up and be a patient advocate. And if you're wrong, you're wrong. But it's best just to bring things forward until proven otherwise. I'm also glad to hear about the mental health resources for the nurses when things go bad, because that happens everywhere. Everywhere you go, there's going to be times when the nurses need the mental health resources, someone to debrief, someone to help them, because we do see some sad things. So, okay, you did a great job with that. Questions for Maya? Okay, before I turn this over to Beverly, I have a question I want to ask each of you is what do you think was the most rewarding part about completing this HRSA experience and being in a small rural hospital? What was the most rewarding part?
I'd say for me personally is it really kind of opened my eyes a little bit. Like I said, I did this a while ago, but now being able to have clinicals in Sioux Falls and having a lot more of the resources there than I did in Viborg, I really am just grateful for what I have. And, you know, I was able to kind of see how not everybody has the same access that other people do. So, really just seeing, working with what we can and um you don't always need everything that you think you do. And I mean the when I was there, we only had two nurses on staff at every time. I mean, there was another charge nurse, but she was doing other things. So just working with what you have is important and you don't need a lot to make a huge impact, I guess.
Love it. That's good, Maya. Somebody else?
For me, I would say the most rewarding was like the patients did a speech the day before they left, and listening to their speeches was actually very like heartwarming and like reassuring that what we're doing is making an impact, and they felt confident going out into the community to be better for themselves and their loved ones.
Okay, Lily, you have to clarify for me. Did you say they did a speech before they left?
Yep.
So what do you mean? Like,
So they would like reflect on their recovery journey and
hmm,
talk about all the challenges that they went through. Yeah.
wow. And so they did this like on the addiction unit in front of all the other patients that are there too?
Yes.
Oh,
Yeah.
love it. I bet that was very powerful.
Yeah.
Yeah. I didn't know they did that. I'm glad you brought that up. Emily or Cameron?
Yeah, so the most rewarding part of my immersion, probably just realizing like how important these small hospitals are still. Like, while we had to send a lot of our patients out to Sioux Falls because, the staff there couldn't always do everything, um, it's still really good that these small towns do have these hospitals because, um, it's still really helpful for everybody in the community.
Yeah. There's probably a lot of patients who wouldn't survive if it wasn't for these small rural hospitals, because some things are just too far away. And if you don't have the this initial support. Okay, great. Cameron, thank you. Go ahead,
Mine
Maya.
was just similar to Cameron's, like just with knowing everybody, everybody kind of knows everybody. Even the doctors know most of the people that come in and they treat. And I felt like I worked hands-on with the doctors a lot. If they were doing stitches or something, like they were in there and they were talking to me the whole time. And the pharmacist would talk to patients and the pharmacist would talk to me and the doctors. Everybody was really they just all really worked together and like they really talked about stuff all the time and everybody threw ideas out and nobody was more or less there. So
Yeah, small rural hospitals are very, very good with interprofessional, right? They're just a small cohesive team, which is wonderful. Okay, excellent. Other questions for any of the students before we turn it over to Beverly? Okay, well, let's go ahead and flip to the next slide then. So again, the students have talked a little bit about the mental health focus. Our big focus on this one now is to talk about mental health workforce challenges in South Dakota, and that's a huge topic. We've the ton you could talk about. So Beverly's just chosen an area of that she's going to speak about to you today. Beverly Minsker. Hopefully I don't mess that up, Beverly. And she's a program manager at the Department of Social Services. So Beverly, do you have a different PowerPoint or you just want to talk kind of? What's up to you?
I do have a different PowerPoint that I can share if that works.
Perfect.
All right, let's see if I can get us set up and rolling.
Okay.
I don't so much mind the presentation piece, but I always hate the tech side of it. So I'll just say
Well,
that.
you did good because we can see it. Perfect.
All right. Good deal. Well, I am going to just talk a little bit about behavioral health workforce and what's next here for South Dakota. The Division of Behavioral Health, obviously, we work with the publicly funded mental health and substance use treatment services across the state of South Dakota. And then we have our prevention services and our recovery support services as well. So we have been working with our providers, obviously, for several years, and we do a quarterly access to services survey essentially from them to find out what access looks like for services as far as like wait times and things like that, which is greatly impacted obviously by their workforce and what they have available for workforce. And so over the years, we continued to see rising concerns, obviously, with vacancies and inability to fill some of those positions, especially in rural South Dakota. And so we opted to start with a landscape analysis of South Dakota to just really find out what we don't know, essentially, or what is unknown out there in the communities as far as behavioral health workforce, and specifically for publicly funded behavioral health. And so my first slide here is just kind of a summary of what that analysis looked like or what we were trying to find. We really explored some research as far as what other states have done in the world of workforce development and some resources that are available for employees and employers. Like the student loan repayment or student loan forgiveness programs, and then some of the learning experiences that are available, which I know some of you have mentioned as far as like HRSA and some of those pieces. So similar for behavioral health. We also had a qualitative aspect for our analysis and really did a lot of key stakeholder interviews and really wanted to get down to the why. Asking what drew you to the work, why do you stay? What motivates you, what sustains you, to really just find out how and why people are staying in this field so that we can get a feel for how to best recruit others. And so there were a lot of conversations, lots of one-on-ones with our agency leaders to get to the bottom of that. We do have this analysis available, and as I'll mention a little bit later, we have a workforce development website that's coming online here shortly, and so that will be available there for people to review, and I'll get that link to Dawn once the website comes online. So to talk about what we're looking at or to level set what we have for the behavioral health workforce, it includes psychiatrists, psychologists, social workers, counselors, advanced practice psychiatric nurses, addiction counselors, behavioral health techs, prevention providers, and other behavioral health professionals, we really are focusing on those working in the publicly funded system, as I mentioned earlier. Those are the providers who are accredited by our agency and then contracted to provide services to indigent South Dakotans. Further keeping in mind that our priority population are individuals with serious mental illness and youth with serious emotional disturbance, as well as individuals with substance use disorder treatment needs, as well as youth and young adults at risk for developing substance misuse without the prevention services and activities that we provide. We also oversee and provide services for those experiencing a behavioral health crisis. We are certainly not discounting all of the important roles that other behavioral health providers play in our state, but we're really just focusing on that population that for the publicly funded services at this point, just to try to move that needle a little bit with that area. So our landscape analysis, we had three top takeaways. First, that we found out is in general, there's not a lot of awareness of what it means to work in community behavioral health. Students were just reporting that they really didn't have a solid understanding of career options when they started their post-secondary training, and they really were not fully aware of what it meant to work with our community behavioral health services compared to other sectors of behavioral health. So they were really more well-versed in private practice and those types of jobs versus the community behavioral health setting. We found out that there was a lot of opportunity to increase relationships between our training programs and behavioral health agencies to provide students with real-world work experiences and for our current workforce to share their passion with the up-and-coming students as to why they love this work. Our second finding was it was really hard to know where to go to find information about behavioral health careers or training opportunities, especially the community behavioral health options. There's no one-stop shop to find that kind of information and what is out there, such as information on licensing boards and things like that. Those pieces are out there and under DSS, but it's a challenge to find. And I think it's also very hard for new students to digest and really understand what is necessary. So we wanted to simplify that. And then our third finding was that training, it's just training through clinical internships or practicums or on-the-job training is critical to development, but it really takes significant time. And so we find that that quality of supervision experience is highly correlated to retention of newer staff. And we know that it's crucial to provide quality supervision, but how to do that is not something that's always well trained. So that was identified as a need. Our community behavioral health providers, we heard that the process tends to be a revolving door for them where new professionals come in, they get their training, they get their supervision hours, get their licensure, and then they move on to other sectors outside of the community behavioral health field. We certainly recognize that's not unique to community behavioral health, but definitely something that we've identified. The other piece is for trainees to get their supervision can be very costly. It can cost quite a bit for their tuition, their education costs, or even their healthcare insurance while they're in training. And, then they're still fielding their basic living expenses, which can be a barrier for people to stick out through that licensure process. So our next steps, we have some near-term goals and some action steps that we're considering to continue forward with workforce development. This is really that publicly funded network of care, but it definitely will impact the broader behavioral health system across South Dakota. We have the two tracks that we're focusing on. The one is focused on the current workforce with strategies to retain the employees and how we can support the agencies we contract with to support the statewide services they deliver. And then the other is focusing on building the pipeline of individuals interested in careers in behavioral health and supporting their path to get there. So how we work system-wide to recruit individuals into the entire behavioral health field. One of our strategies is continued training and education efforts to build and sustain the competency of the workforce. We understand that this work is very hard, and we want to provide people with the tools they need to be able to effectively treat and respond to the needs of the clients. Knowing what to do, even in the face of really challenging cases, can make all the difference. And it really does assist in retaining employees when they feel confident in their skill sets. This slide again shows some of the titles of the staff that we are targeting through our efforts. Just some numbers that we have. So our agency, Division of Behavioral Health, contracted with 41 treatment and prevention providers in fiscal year 25. Over that time, we supported 38 trainings across 25 different evidence-based practices, and we provided that training to 686 different treatment providers. So that's something that my team does specifically is we contract for the trainings and really get that word out and make sure that we're providing to as many of our providers as we can so that they're well trained and able to work effectively with clients. We do also work with the current providers we have to set priorities around training their workforce and collaborate on what type and volume of training they need. We've really seen our trainings needs shift over the last 10 to 11 years to meet the needs of clients, which includes EBPs that focus on treating trauma for the individuals we're now working with. So for track one, just kind of move on a bit here. We've identified the need to support agencies and clinical supervision practices. So in the last couple of years, we've had that opportunity to work with and collaborate with the USD social work program through the HRSA grant fund initiative that was aimed at improving workforce development of master's level social work students that worked within the community mental health center system and the human services center. We also have identified to move forward some additional efforts, such as conducting a review of national programs in clinical supervision that may provide insight into established best practices, models, or curriculums that we could consider for South Dakota agencies. Also considering the development of a technical assistance plan that's rooted in best practices to aid clinical supervisors in their training so that they know how to provide that clinical supervision. Just another add, in the 2024-2025 school year, we've attended several scrubs camps, which I'm sure many of you are familiar with, and facilitated attendance by our behavioral health providers. So those folks that are actually working in the field so that they can share information with the students and really give them the nitty gritty of what it looks like to work in the behavioral health field and really convey their why, because I think that's so important to hear why people do it and what they love about it. We've also partnered with HOSA, the Health Occupation Student Association, to do breakout sessions, career fair booths, judge some of their competitions, and to be on the front end of that state level in sponsoring and supporting efforts to recruit students in health careers in the behavioral health field. We've done this with our other behavioral health agencies so that they also have that opportunity to spotlight their passion for their students as well. So moving on, I did mention currently that there's not a one-stop shop for all levels of the behavioral health career pipeline. And so that is one of our priorities. We just really want to make awareness of the field, how people can get involved, how they can get started, and what training they may need to take, because there really are opportunities at all level of education to be in the behavioral health field. We are working on that behavioral health career website, and I hope that we can have that up and running by the end of the week, but we are waiting on our state IT department to just confirm that that's good to go. So we're kind of on their timeline right now. But once we have that up and running, that will give individuals a lot more information about how to get into the field, what it takes to get licensed. Some training opportunities will be out there. We will have the information on the financial support, such as HRSA or the SLRP loan and different things like that. So we'll also work again to continue to explore some collaborative opportunities with our stakeholders just to sustain the workforce efforts in South Dakota. So with that, that is kind of a wrap up of what I had. I'm open to any questions.
Thank you, Bev. What questions do people have for her? I had multiple things I was going to ask you about, and then you pretty much hit them all. Like I was curious what you were doing in the high schools.
Yeah.
But it sounds like you're starting a lot in high schools or doing a lot with the HOSA and with the scrubs camps, because it seems like the high schools is when they're really starting to think, about their careers. So I think that's fantastic, and all the different programs you had. One question I have is there any thought about any getting grants or anything to help pay for, since the cost of school is such a barrier for so many people, to get scholarships going? Or
we had some thoughts and ideas. I will just say we're kind of on hold, as a lot of people are right now with the federal government and the state that it's in, and some of the reductions that have happened. So I think we're kind of waiting to see how things play out before we could really move forward with that.
Yeah, I hope that gets resolved, because we could really use, these students would all tell you it is expensive, yes, to go to school, and financial help always is huge. I'm also curious about the Build Dakota, through the VOTEX. I did hear you say you were talking about maybe working with the VOTEX, so that might be another opportunity.
Yeah, I know that in Southeast Tech, I know that they worked with Build Dakota there. Oh my gosh, Tracy Bird, her name was escaping me for a second, but I know she's done some work there and definitely is exploring options for her behavioral tech students as far as what scholarships are available.
Perfect. Okay. Well, thank you for all your efforts and what you're doing to try and get more people to choose mental health career options in the state, because we definitely need it.
Absolutely.
Okay, other questions from people? I'm going through looking at all the students. Everyone's just being bashful. Okay, other questions for any of the students then? All righty. Well, Stacy, I'll turn it back over to you. I think we might end a little bit early, but I want to just thank the four of you for speaking, the students, and then also Beverly for joining us. I think it was very, very informative as usual. And I love that the mental health focus we did because it's such a huge need in our state. And really appreciate you all joining us. And Stacy, I'll turn it over to you.
Thank you. I just dropped the survey that you see on the screen right now in the chat to make it easier to click or copy and paste. If you would please do us the kind favor of taking a couple minutes of your time to just share feedback. It really helps us as we plan future sessions, and it goes a long way in shaping new webinars with our presenters. So thank you for doing that. Once again, thank you for taking the time out of your schedule today. We really hope that you enjoyed this. Our next session will be held next Monday, same time. So be sure to register for the USDI Echo page, which will give you updated information on the invitations as well as the Zoom link when it is available. Again, this will be archived on the grnen.org website by the end of the week. So feel free to come back to this, share this with friends, colleagues, whomever else you think would be would get a lot out of it. We look forward to seeing you at future sessions. And thank you. Have a great day.